What if I told you that over 80% of America's hospitals utilize products from a single company? You'd probably envision some giant in New Jersey or Basel or London, but do you believe it started in a rented office in Amman, Jordan, with $1,200? This is the story of Hikma Pharmaceuticals, a $3.1 billion giant that is quietly and reliably powering the global healthcare system. Its secret? No billion-dollar patents, no celebrity CEOs, just a relentless focus on quality and a powerful silent network of generic injectables sold in over 50 countries. If you've ever been hospitalized in the US, there's a good chance a drug from Hikma was part of your treatment. So how did a small Middle Eastern generics maker manage to penetrate the most regulated, most competitive pharma market in the world? How did it match wits with Big Pharma without the blockbuster medicines or the huge marketing budgets? The answer is that it employed an unconventional approach and demonstrated strong loyalty to a straightforward yet potent philosophy. Our story begins in 1930 in Nablus, Palestine, with the birth of Samih Darwazah. In 1948, he was one of hundreds of thousands of Palestinians displaced by the Nakba and fled to Jordan. He went on to the United States, where he studied pharmacy at Purdue University. He then spent over a decade at America's largest pharmaceutical company, Eli Lilly, learning the business from the ground up. At the close of the 1970s, Samih realized that a significant gap existed in the market. The Arab world was predominantly dependent on expensive imported medication. He asked a simple but essential question: why can't we produce this ourselves? In 1978, with $1,200 and a modest rented premises in Amman, he founded Hikma Pharmaceuticals. There wasn't a factory nor patents, but merely one singular aim: to manufacture quality medicine locally. Hikma started small, with straightforward medicines like painkillers and antibiotics. But Samih understood something early on that many of his competitors ignored. When it comes to medicine, credibility trumps speed. Where other generic makers cut corners to save costs, Hikma went the other way. They obsessed over quality. Samih spent extravagantly on world-class manufacturing, best-in-class clean rooms, and uncompromising compliance. That was their edge. And it paid dividends. Hikma was the first Arab company to receive FDA approval to export to the United States in the 1980s. It was a huge leap. Most generic firms are only trying to enter the US market, but Hikma did not just enter it. Hikma constructed itself within it. They set up a plant in New Jersey in the early 1990s, but they did not try to make everything. They decided to concentrate on one of the most difficult and central categories: injectables. Injectables are the drugs you get in a hospital setting: chemotherapy, anesthesia, antibiotics, and emergency life-critical medicines. They are harder to make, more regulated, but higher margin and are harder for competitors to copy. This decision would be the one that would determine Hikma's future. Hikma was floated in 2005 on the London Stock Exchange, raising over $300 million and entering the ranks of the elite FTSE 100 index. While it started in Amman, it now has its base in London and is a British multinational with close Middle Eastern roots. The growth of Hikma from here was strategic and measured. They used acquisitions to increase manufacturing, penetrate new markets, and reinforce their portfolio of products. They bought a U.S. generic operation from Baxter, injectables operations from Boehringer Ingelheim, and German and Portuguese manufacturing sites. It was not size for size, but to build capability, acquire licenses, and strengthen distribution channels. By 2024, they had 29 factories in 10 nations with 8,800 employees. This was not rapid expansion. This was strong, focused growth. The brilliance of this approach came sharply into focus with the pandemic. As the global pharmaceutical supply chain disintegrated and hospitals ran out of essential medicines, Big Pharma couldn't keep up. Hikma could, though. Their U.S. injectables business became a lifeline, supplying frontline hospitals across the country. While the world watched vaccine headlines, Hikma worked behind the scenes to ensure that hospitals contained the painkillers, antibiotics, and anesthetics necessary to function. By 2021, they were one of the most essential drug suppliers in American medicine. Samih retired in 2007 and handed the business over to his son, Samih Darwazah. Most family businesses, however, did not professionalize as early as Hikma. They brought in outside investors, expanded the board to become more diverse, and decentralized across global hotspots. That mix of family values with institutional size allowed Hikma to maintain control without inflexibility. Hikma's story is not one of chasing publicity bait patents or blockbuster headlines. It's one of playing the long game. It did not quality as a box to be ticked, but as a moat, a competitive advantage, the reason regulators trusted them and hospitals came to depend upon them. It didn't get flashy. It incrementally grew. Hikma never did all for all. It instead humbly perfected the art of focusing. Instead of chasing trends or rapidly expanding without controls, it knew the correct opportunities at the correct times. Strategic acquisitions didn't mean fanfare. They meant building strengths and keeping its focus on mission. Every step became less risky and more of a strategic chess game move. That's how it expanded at home and internationally, never losing its ground, but proceeded with all due purpose. Up to $3.1 billion of revenue and $700+ of annual operating profit by 2024, all without ever achieving widespread recognition. As pharmaceutical titans Pfizer and Johnson & Johnson are busily developing the next miracle cures, Hikma performs less showy, but no less critical. It gets the life-saving drugs on which we now depend as far as they have to go, always on time, at scale, and with unrelenting quality. In its full, jammed, and struggling at its best days for the health system, Hikma exudes the leadership spirit and resilience of operations. Not disruptive at all, about staying power. Hikma never gets the blockbuster story. It gets the story of staying power, consistent leadership, and humble influence. And now and then, those very same companies which transform the globe the most, the ones which never put their hand up seeking assistance doing so. If you like this story, don't forget to like this video to allow us to share it with others. What's a company you think is working behind the scenes to change the world? Let us know in the comments below. And don't forget to subscribe for more tales of the unsung business heroes.